Just to update everyone, no, I just received the quiz of Dr. Jing Bautista for your prelim grade, so I still haven't finalized your prelim score. But it seems na you did okay. No, I've seen the lab grades, your lab grades from Miss Dearborn, and they're quite good. There were a few of you in having low quiz scores with Dr. Jing Bautista, but I think they can be pulled up. No, even your exam scores were relatively okay. So I'm pretty sure you will get a very nice score for your prelim grades. Okay. So do you have my slides on Cestodes already? Because it's the same from last year. Does anybody have a slide? A copy of this slide set?
Doc, good afternoon. We'll check, Doc, if ever, Doc.
Okay. If you don't have and if you want, just have your classmate or email me so I can send a copy to you. Okay? Sige. So let's start. By the way, have all your lectures pushed through? Are there postponements or lectures that have been missed so far?
So far, do wala man, Doc.
Okay, sige. That's good. That's very good. Sige. So today we're going to talk about a very important, although not so common, by the way, not so common disease parasite, no, uh, that we need to know. And like in all other parasitic organisms, we need to just memorize a few morphologic features because and like I've said, with parasitology, we'll be focusing on the um, life cycle of the diseases. Okay, so we'll be talking about cestodes today. Okay. So another name for cestodes, or the common name for cestodes, are tapeworms. And when we talk about the morphology, you will realize why they are named as such, no? Because the general structure of each of these cestodes will be tape-like. The adult of this will appear like a tape. So morphologically, they are described as having whitish to yellowish with a flat ribbon-like characteristics of their bodies. The adults generally inhabit the small intestine, and they do not have a digestive system, but rather they would just absorb food, their food from the environment in the small intestine. So, so the adult organism is composed of a body and a scolex. Okay, so the scolex is considered as sort of the head of your tapeworm, and it is generally functions for attachment of the organism to the intestinal mucosa. Uh, it is generally muscular and has features of cup-shaped suckers. Okay, please take note of the type of suckers or the appearance of these muscular suckers, because these are, in some organisms, they are characteristic. In the tip of the scolex, you have what is termed as the rostellum. And the rostellum may contain hooks or may appear naked without hooks. And the type of hooks and the number or the amount of hooks is also characteristic for each of these organisms. I will just point out these differences, and for you to easily memorize these features. Behind the scolex, there is a very short neck, and after that, you will have the body. Another term for the body of your tapeworms are proglottids. And each segment is formed from the neck, and new segments are formed throughout the growth cycle or throughout the life of the organism. Newer segments are termed as immature, and they contain actually they do not even contain any observable male or female characteristics. As they extend further, they become mature segments, and this time they will contain viable male and female reproductive organs. And the number of male and female reproductive organs and the appearance of these organs are also characteristic features in some organisms. Beyond the mature segments, you will have what is termed as rapid or ripe or gravid segments. These are called gravid segments because they are filled with eggs. No? The uterus of these segments are filled with eggs, and oftentimes they are terminally located. If you look at the drawing, the figure there, and compare the shape of mature proglottids and gravid proglottids, the shape of that is also characteristic. Some proglottids can be wider than they are long, or they are longer than they are wide. Okay. So the eggs of the tapeworms mostly do not have an operculum. Okay, so in your laboratory, probably you were able to observe these eggs. No? Inside the eggs, you will have the embryo, or what is termed as the oncosphere. And the embryo will contain 6 structures which are elongated hooks or hook-like structures, which actually will be used by the released embryo for attachment to the intestinal mucosa. So a life cycle of your tapeworms will generally have a definitive and an intermediate host. No, definitive host, which means that they harbor the mature or the adult worms of this organism. Intermediate host will just harbor the larvae or the interval form of the organism. Then each of these hosts will have their own infective stages. So you have an infective stage that will infect the definitive host and a separate infective stage that will infect your intermediate host. And then you need to take note of the mode of transmission. Because the importance of the mode of transmission, if you know it, you can actually institute preventive measures so that you cannot get infected or prevent infection from the tapeworms. So let's start with the first organism. Okay. What we have here is Diphlobothrium latum, otherwise known as the broad tapeworm or the fish tapeworm. So the name itself implies that its life cycle involves fish. So mode of transmission to the definitive host is ingestion of insufficiently cooked freshwater fish. Okay, that's the mode of transmission. And the infective stage is the larvae within this freshwater fish. Signs and symptoms of D. latum infection is generally asymptomatic. However, they compete with certain vitamins by absorbing these vitamins in the small intestine, and it may present with a disease that resembles pernicious anemia. And it has 2 intermediate hosts, which we will see in a short while. Okay, so a life cycle. Let's start with the eggs that are released in the feces. Okay, so eggs released in the feces reaches the body of water, and they hatch to release a ciliated coracidium from the embryo. Okay, this small coracidium will be ingested by your first intermediate host, which are copepods. So the first intermediate host of a D. latum is a copepod, and the infective stage for copepods is a coracidium. Within the copepods, they will mature to form the procercoid larvae. And this is termed as the procercoid stage. Okay, this is sometimes termed as the first larval stage to produce a procercoid larvae. Okay, fish will now ingest your copepods, which contains the procercoid larvae. The procercoid larvae will be released and will now enter into your second larval stage, or the plerocercoid stage. And in this stage, the larvae will now grow in the flesh of the freshwater fish to form the plerocercoid larvae. So your second intermediate host for dilatum are freshwater fishes, and the infective stage for your fish is your procercoid larvae to produce the plerocercoid larvae, which will now be the ones that will be ingested by your definitive host, in this case, humans. So the infective stage for dilatum to its definitive host is a plerocercoid larvae. Okay, I hope you get that. Okay, so that's a picture of a copepod. And this is from the CDC, the short life cycle of your dilatum. Okay. So how does the adult worms look like? No? They can appear or can be up to several meters in length. The scolex is typical. Its shape is elongated, spoon-shaped, with two longitudinal grooves. Okay, let's see if we have that. Oh, no, we don't. Okay, but it is spoon-shaped, elongated, with just two grooves, okay, which will serve as suckers. No? The uterus of your dilatum is a coiled tube with a rosette arrangement. The gravid segments are wider than they are long. Okay, so they are lapad. No? The ripe eggs are discharged in the feces, and they appear ovoid with an operculum. Okay, so take note, we mentioned that in general, tapeworm ova or eggs do not have an operculum. In this case, dilatum is an exception because the eggs of dilatum will have an operculum. So it is smooth, moderate thickness, yellowish brown, which is a general feature for most of these organisms, except for the operculum. So both eggs and proglottids can be released and can be found in the stool. Some organisms do not release the proglottids, so only eggs are found in the stool. In dilatum, both eggs and proglottids are found in the stool. So that is this one on the figure, the small three structures there is the appearance of the uterus of your dilatum, appears like a coiled tube with a rosette arrangement. And on the other side, you have a proglottid that is wider than it is long. No? The perpendicular dimension is shorter than the horizontal dimension. So it is wider than it is long. And if you take note of all these pink dots, okay, those are the ova of your dilatum. Okay, that is an ova. You have an operculum on this side. Okay, and not very clear, but you have an oncosphere, and you could not see the hooks in this figure. Okay. We mentioned clinically your dilatum infection is generally asymptomatic. Patients may present with a non-specific abdominal signs and symptoms. So bloating, flatulence, vague abdominal pain. In infections that are very many, you can have clinical vitamin 12 deficiency, especially if your organism is found in the proximal jejunum, because it competes for B12 absorption in that area. Okay. So proximal jejunum will now present with B12 deficiency or pernicious anemia in dilatum infections. Okay, so how do we treat? You treat them with praziquantel. So like in drug treatments for this, yeah, I don't really need you to memorize the actual dose. But if you want to memorize, that's still fine. No? The treatment is praziquantel, but you can use niclosamide as an alternative. So how do we prevent or control the infection? Number one, proper disposal of human waste such that the infected feces do not get into bodies of water. You need to properly cook fish or frozen at negative 100 degrees Celsius for at least 24 to 48 hours. So those very fond of eating raw fish, this is a risk factor for dilatum infection, especially if these are freshwater fishes. Okay. Okay, what is sparganosis? Okay, so this is an infection of a plerocercoid larvae of Spirometra species. So you remember what is a plerocercoid larvae? So the procercoid larvae, you ingest the procercoid larvae. No? Humans generally do not ingest the procercoid larvae because the procercoid larvae will infect your second intermediate host. Okay? In this case, man becomes the second intermediate host. So they get infected by the procercoid larvae from the first intermediate host, and the procercoid larvae will mature to become will not mature actually, will transform to become the plerocercoid larvae. And usually this is seen in Spirometra species. Okay. So humans, in this case, will be the second intermediate host and will contain the plerocercoid larvae. And in general, because humans are not being eaten by other humans, this is a dead end in the life cycle of Spirometra. So mode of transmission, drinking water containing the copepods with a procercoid larvae. Okay, mode of transmission is drinking water. Infective stage for sparganosis is procercoid larvae. So they can also be actually transmitted by ingestion of raw snakes or frogs with plerocercoid larvae. Okay, so what happens? No, ingestion of raw snakes, the or frogs containing the plerocercoid larvae, the plerocercoid larvae will not transform into a mature form, but rather will just migrate to the muscular areas of humans. So they remain as plerocercoid larvae. Or if you use in certain native practices in the mountains, they use sometimes frog meat as poultices for wounds. And if that frog meat contains plerocercoid larvae, the plerocercoid larvae can migrate into the muscle of humans. So you have three forms of mode of transmission for sparganosis. Okay. So you also have actually two infective stages. It can be a procercoid larvae from drinking water, which is the most common of the three, or as a plerocercoid larvae by ingestion of raw snakes, frogs, or using frogs as poultices. Okay. If the question states like this, the infective stage of sparganosis is, and you have procercoid larvae and plerocercoid larvae, which are both correct, but you do not have a choice for A and B, you pick the most common, which is the procercoid larvae. Okay, is that understood?
Yes, Doc.
Okay, sige. Let's continue. So this is a diagram of sparganosis. The most common definitive host for sparganosis is actually wolves, canines, cats, dogs. In the picture, they include lions because they are actually infected when they eat the second intermediate host, which in this diagram, mentions that it can be frogs, birds, snakes, mice, rats, or if dead bodies are thrown or left in the forest and they contain the plerocercoid larvae. Okay. So how will it appear? The plerocercoid larvae is sometimes termed as sparganum, and it appears as a wrinkled, whitish, ribbon-shaped larvae. The anterior end is capable of invagination and has an appearance similar to sucking grooves. Proliferating larvae may break, and the broken portions are capable of further development. So, what are the clinical signs and symptoms of the disease? In the early infection, it can be asymptomatic. But depending on the location of where it migrates, they can cause painful inflammatory conditions of the surrounding tissue. So if it goes into the eyes, it can become or ocular sparganosis characterized by periorbital edema and even corneal ulcers. They can migrate into the brain and present as cerebral sparganosis characterized by having features of seizures, paresthesias, hemiparesis, or stroke-like symptoms. Okay, so the diagram, that is the sparganum coming from the eyeball. This is probably, okay, it's mentioned here, this is the sparganum traversing the parietal pleura, and this one from brain tissue, removal of the sparganum from brain tissue. So diagnosis, you have to document or you have to remove surgically the organism from the tissue of your examination. Treatment is by surgery if you remove the sparganum, or you can treat with praziquantel. Okay. Prevention, avoid drinking water contaminated with coffee pods. So in general, avoid drinking unsure or unclean water, especially when you're fond of mountain climbing, trekking, or going into places wherein the water source is not very reliable. Okay. So that's just a diagram showing to you tapeworms in the stomach wall. Okay, so now let's proceed to the more common ones. You have Taenia solium or the pork tapeworm. Mode of transmission is eating raw or undercooked pork. Another less common is you can directly ingest the eggs of the pork tapeworm, and this will present with cysticercosis. Okay, and we will see later on what is the difference between the disease of cysticercosis and between the presence of the adult tapeworm in your intestines. Or it can be transmitted, again, not as common, by reverse peristalsis. Okay, what happens in reverse peristalsis? The eggs are supposed to be excreted in your feces, but because of reverse peristalsis, instead of the eggs going out into the anal orifice, they are actually brought back up into the small intestine where they hatch and become infections. Okay. So you have one intermediate host, which are pigs as the most common. Other that can serve as intermediate hosts will be humans and dogs. It has only one definitive host, which are humans. Ay, sige. Sige. So the first mode of transmission is ingestion of infected or undercooked pork or raw pork, which contains the embryonated eggs. Okay. So what happens? The embryonated eggs are secreted in the feces and will be ingested by pigs with their food. The embryonated eggs will hatch in the pigs, and the larvae that is released will penetrate the muscles of pigs and become cysticercus. Okay. What is now is a cysticercus. Okay. A cysticercus is a thin-walled bladder which just contains the scolex of the organism. Okay. When you eat raw pork, which contains the cysticercus, the scolex will now attach to the intestinal wall and will start producing proglottids. Okay, so this is the most common life cycle. Ingestion of raw pork or undercooked pork containing the cysticercus. So your infective stage for T. solium is the cysticercus larvae. Okay, that is one. Let's see. Oh, no. Okay. So we mentioned that is, let's go back to the life cycle, the mode of transmission. So that is the most common mode of transmission, eating raw or undercooked pork. The second was here, ingestion of eggs. So ingestion of embryonated eggs, if you as a human ingest the embryonated eggs, the eggs will again hatch within your stomach and the larvae will penetrate the muscles and become cysticercus. Okay, so in the second mode of transmission wherein eggs are ingested, the humans will be serving as your intermediate host. Okay, in the third mode of transmission, which reverse peristalsis, um, humans will be serving as your second intermediate host also. Okay, so let's proceed. So what are the characteristics of the adult pork tapeworm? So they can be also several meters in length. There are several issues, which is the longest. Some books would say it's T. solium, your pork tapeworm. Some books would say it's your T. saginata or your beef tapeworm. So, but definitely these two are the longest tapeworms that can infect humans. So the scolex is characteristic. It has four suckers, round-shaped suckers that are muscular with a double crown of prominent hooks in the rostellum. Okay, please take note that is important because it will help us differentiate the other tapeworms later on. Okay, so that is the adult tapeworm and that is the scolex. You have four muscular suckers and two rows of horns. Yeah, sometimes called as horns, sometimes called as hooks. Okay. The proglottids, when mature, they are wider than long, so similar to dilatum, and will contain one set of female and male organs. Okay, this time, the gravid segments are longer than they are wide. So this is the difference in their gravid segments with dilatum. In dilatum, it is wider than it is long. In T. solium, it is longer than it is wide. And please take note, the uterine side branches will be anywhere from 7 to 13 in number. Okay, and we will be showing to you the uterine side branches. So this is wider than it is long. You have one male and one female, and you have a genital pore, which is where your eggs are being released. Okay, so you have a genital pore on one side. Okay, only on one side, because later on we will see that there are some genital pores that are found on both sides of the proglottids. So in this case, it's found on only on one side here, another one here, another one here. You have the ovary, and the vitellaria is the male pore. Is the part of the male testis. Okay, so next, okay, this is the gravid proglottid of your T. solium. It is longer than it is wide, and you have uterine side branches. So this is the ovary with the uterus there, and you have side branches. So this is one side branch, 2, 3, 4, 5, 6, 7, 8. Okay, so side branches between 7 to 13, that is T. solium. And we'll see later on in T. saginata that it is also has a different characteristic feature. Okay. Okay, another view of your gravid proglottid. The eggs are not for identification, but they have a radially striated coat. And again, you have a 6 hooks. Clinically, generally, they will present as asymptomatic or can have vague abdominal discomfort, hunger pangs, or indigestion. If you get your CBC, these patients may present with a moderate eosinophilia. Treatment is praziquantel, just single dose, or alternative is niclosamide, so the same as your Dilato. Okay. So now we go to the cysticercosis. So cysticercosis is where a human will serve as the intermediate host for T cell or other stages or other species of the Taenia. So what happens? Humans ingest the eggs. Once ingested, there is the integration of the cell wall to release the oncosphere. The oncosphere will invade the intestinal mucosa using the 6 hooklets and will enter into the blood vessel and is spread to different parts of the body, more commonly on the voluntary muscles, where they now become cysticercus larvae, which are elongate, oval, semi-transparent, or opalescent white larvae in your muscles tissues. Okay. They can spread to the eyes also and cause ocular cysticercosis, can present with visual difficulties, visual field defects. Depending on where they are located, they can cause retinal damage, retinal hemorrhage, vasculitis, or even detachment of the retina or the eyeball. More devastating will be if they migrate and penetrate into your central nervous system to produce neurocysticercosis, which is considered as the most common parasitic disease of the central nervous system. Okay. In its most common presentation, neurocysticercosis will be characterized by arachnoiditis with increase in CSF WBC or spinal fluid pleocytosis, increased CSF protein, and will present with a positive serologic test for cysticercosis. If in some areas, they can cause obstructive hydrocephalus, they can cause cranial nerve involvement, arterial thrombosis, or even stroke-like symptoms. If you treat them, the dying cysticercus can release cytokines and can have a cytotoxic effect on surrounding tissues. So that is a very severe form of neurocysticercosis, showing to you a lot of cysticercus larvae in brain tissue. So the most common, however, will be muscular neurocysticercosis, generally asymptomatic. However, they may cause myositis, presenting with fever and eosinophilia. Your muscles may appear abnormally large, which is termed as muscular pseudohypertrophy. The cysticercus will eventually die and can calcify in this muscle tissue. So diagnostic, you can diagnose them by surgical removal and demonstration of the organism from the various tissues. You can do an X-ray and show calcified cysts, or if it's in the orbit on the eyeball, you can do direct visualization by your fundoscopy exam. Suggestive signs and symptoms, especially in neurocysticercosis, will be signs and symptoms of a space-occupying lesion or even stroke. Okay, you can do a blood or a plasma serologic test, which will be negative in cranial nerve cysticercosis. Okay, in neurocysticercosis. Remember, let's go back to the neurocysticercosis. Okay, We mentioned that serologic test is positive in neurocysticercosis if you use your CSF as the specimen. However, if you use your plasma as the specimen, serologic test will be negative in cranial neurocysticercosis. Okay, that's a difference there. Huh? So epidemiology, so ingestion of eggs will be passed in the feces. So how do you prevent? There should be proper disposal of waste. Okay, to prevent cysticercosis, you avoid ingestion of raw or undercooked pork. You can do, for example, if you want to prevent GID further, thorough cooking or freezing of pork prior to eating them. So treatment, if it's symptomatic, you can do supportive treatment for pain. You have to remove in certain cases. For neurocysticercosis, you can give albendazole, but you have to give the albendazole for a longer period of time, which is 8 days. Okay, drug of choice for neurocysticercosis is albendazole. Your alternative is praziquantel. Okay. So beef tapeworm, another Taenia species or Taenia saginata. The intermediate hosts this time are cattle. Again, humans are the definitive host. Life cycle, similar to T-solium, except that it's ingested by the intermediate host is cattle. And cysticercus does not occur in humans in cases of T. saginata. Okay, that's another difference with T-solium. Okay. So the books would mention that it can be up to 25 meters in length. Scolex, you have 4 muscular suckers, similar to T. saginata, but your rostellum is just small and doesn't have hooks. So the figure A is the T. solium. You have 4 muscular suckers and a double row of hooks, where in T. saginata, you have the 4 suckers, but your rostellum is bare or naked without any hooks. So mature proglottids, it is almost square. However, it can still be described as wider than long. You still have your genital pore on one side. You have your male and female single. Gravid proglottids, however, are longer than wide, so similar to T. solium. They are passed in the stool, longer and wide, but much longer when compared to T. solium. And your uterine side branches are between 15 to 20. So you have more uterine side branches. That is probably the reason why they are longer than T. solium. So if you count, that is actually more or less more than 15 to 21, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. So mga almost 20 uterine side branches. So that is, when you see that in your slides in your lab, that is automatically T. saginata. So life cycle, almost the same. Okay, so this is just a comparison of both. Okay, next, let us proceed. So treatment, surgical removal. Okay, because you don't have neurocysticercosis, you don't have actually, you can use praziquantel or albendazole, but in a shorter period of time. Echinococcus, okay, sometimes called as Hydathy disease. It comprises several species, Echinococcus granulosus, Echinococcus multilocularis, Echinococcus vogelii. Okay, intermediate host are sheep, cattle, and humans. So for Echinococcus infections, we humans are just the intermediate host. Your definitive host will be canines that actually attack or eat sheep and cattle. Not common epidemiologically, they're common in the Mediterranean areas, not common here in the country. So a distinctive feature of Echinococcus granulosus, it is a very small worm, no? About zero 0.6 centimeters. So that's about 6 millimeters, very, very small. It's only composed of a scolex, a very short neck, and 3 proglottids. A mature, an immature, and a gravid proglottid. Oops, wait, let's go back. Okay. The eggs of E. granulosus are indistinguishable from Taenia species, and it also has 6 hooklets, so almost the same. Life cycle. Okay, embryonated eggs are released in the feces, ingested by humans, but normally they are ingested by sheep. And in the sheep, they now mature and form what is termed as hydatid cysts, more common in the lungs, but can also occur in the liver. Within the hydatid cysts, they become mature. The hydatid cyst will now be ingested by your definitive host, and within the definitive host, they are released. The scolex attaches to the intestine and become mature. Okay. So this is the usual life cycle in red. We are an accidental intermediate host. So infective stage, when you talk about humans, is your embryonated eggs. Infective stage for the definitive hosts, which are canines, will be a protoscolex or the hydatid cyst. So embryos are released in the small intestine of the definitive host. I don't know. The embryo is released from the eggs in the small intestine, burrows into the intestinal wall, enters the blood vessel, and invades the liver and the lungs, and develops the hydatid cyst in the intermediate host. Within the liver and the lungs, it matures, no, and develops vacuoles or brood capsules. Okay. Within the brood capsules, you will have protoscoleces. Okay. And they would bud out from the brood capsule to produce daughter cysts. The daughter cysts will now be the ones that will infect your definitive host. If they remain too long and the intermediate host is not eaten by the definitive host, they will later break down and degrade and will become termed as hydathic sand. Okay, so that is how your brood capsule would look like with several daughter cysts which contain your protoscolex. Okay, an actual histologic picture of your protoscolex. Okay, ultrasound figure. And that is how it would look. Your liver would look with several brood capsules and hydatid cysts. So those are cystic structures which contain the daughter cysts and the protoscoleces. So if eaten by the definitive host, they will now be released and infect your definitive host. Okay. So diagnosis, you can do radiography, CT scan, ultrasound, aspiration, and examination of the cystic fluid or serologic tests. Symptoms will depend on the location of the cyst. Okay, an expanding cyst can cause pressure necrosis in the area. If there is leakage of cyst contents, you will have eosinophilia. Rupture of the cyst, releasing a lot of cytokines, can cause anaphylactic shock. And if your patient survives, it can be It can spread the infection to other surrounding areas. Okay. There is some form of circulating immune complexes and can eventually lead to membranous nephropathy. Okay, because these circulating immune complexes can be deposited in the liver, causing membranous glomerulonephropathy. So, epidemiology, the adult worms are acquired by your definitive host by eating entrails of infected animals. Treatment for hydatid cyst in humans will be albendazole or mebendazole, or in certain cases, you can do surgical removal of large affected areas of your liver or your lungs. Okay. Okay, so another tapeworm is Dipylidium caninum. Okay. The eggs will be ingested by fleas. So the fleas are the intermediate host. In the fleas, they develop into cysticercoid larvae, and humans can accidentally ingest the fleas, and we now harbor the adult worms in our small intestine. Okay. So those with dogs and cats, make sure your pets are free from fleas. Okay, so that's just a diagram. So this is the appearance of the adult Dipylidium caninum. It is about 15 centimeters in length, and one host can harbor many organisms. The scolex also has 4 suckers, but the rostellum is conical and can be retracted. No, it has a retractile rostellum with several circles of small hooks. So 1, 2, 3, 4, about 4 circles of small hooks in this case. So they still have 4 suckers, but the rostellum is retractable with several circles of small hooks. The mature proglottids, okay, mature are longer than wide. The previous discussions, the mature is wider than long. This is the first time that we have a longer than wide mature proglottids, and it contains 2 sets of male and female organs. And because it has 2 sets of male and female organs, you have also 2 genital pores. Okay, so the developing uterus will form a network which later breaks up into units which are termed as egg packets containing 5 to 30 eggs. So this is one egg packet, and I think we have a higher magnification picture later on. The gravid segments are now barrel shaped, and this is a diagnostic feature of this disease. So when you hear a barrel-shaped gravid segment, your diagnosis will be D. caninum. Okay, so, yeah, there. Okay. Light infections are just asymptomatic with presenting with abdominal pain, vague abdominal pain, diarrhea, or even itchiness. Treatment is praziquantel and niclosamide. So control the worming of cats and dogs and control of fleas. Okay, we are just an accidental definitive host of this organism. So this is an appearance, retractile rostellum, 4 suckers, longer than wide, mature segment, longer than wide, 2 sets of male and female, 2 sets of genital pores, longer than wide, then barrel-shaped gravid segments with egg packets. So all these cyst-like structures are egg packets in magnification, egg packets with several eggs inside. Okay. Next, we have Hymenolepis nana. These are the not so common ones, and you will take note that the slide would look like this, very simple. So definitive host, humans and rats, intermediate host, grain beetles, infective stage, eggs, or cysticercoid larvae. H. nana, the adult again are small, you have 4 suckers. Then you have a rostellum with one circle of hooks. Okay, so you still have a rostellum, but only one circle of hooks. The segments are wider than they are long. Okay, so this is a mature segment, very, very wide than it is long. It has only one set of male and female, and the gravid will be filled with eggs. Okay, this time the eggs of H. nana and the next time H. diminuta will be characteristic. So this is the only time wherein the eggs are also have characteristic features. So the eggs, they are released before the segments are detached. So meaning the eggs are released first, the proglottids remain inside. So you will seldom see the proglottids together with the eggs. They are ovoid, thin, smooth outer shell. What is important are the oncosphere. It contains 6 hooks. Yes, you have, as the others, you have 6 hooks, but you have a rigid membrane with 2 polar thickenings or knobs. So this is a polar thickening at one end, another polar thickening at the opposite side, and each polar thickening will have 4 to 8 polar filaments. So each of those polar thickenings will have polar filaments. In this case, you can see them, okay, in the, I think, wet mount picture. Okay. So we went back. So life cycle, you ingest to have 2 types of life cycle. No, ingestion of eggs, hatches in the small intestine. The oncosphere burrows into the villus, which is sometimes termed as the tissue phase. When you see a tissue phase in these parasites, it simply means that the larvae is penetrating or moving through your interstitium or your tissue or your muscles or your other structures. And this tissue phase is responsible for the presence of eosinophilia. Right? So the oncosphere will become a cysticercoid larvae in a few days, and it breaks out into the intestinal lumen and grows into adult worms. Because of the tissue phase wherein there is the development of immunity in this type of life cycle. Okay. The second life cycle, not so common. You ingest the beetles already containing the cysticercoid larvae. Because you ingest the cysticercoid larvae will be released in the intestine and become adult worms. There is no tissue phase. There is no invasion of your oncosphere into your tissues, so there is no tissue phase. So there is no immunity or tissue immunity in this case. And because there is no tissue immunity, this stage is prone to hyperinfection, meaning you can get infected by large numbers of H. nana if this is the mode of transmission or this is the life cycle that happens to you. Okay, so that's just the life cycle. Clinically, light infections will be asymptomatic. Heavy infections will have abdominal pain, diarrhea, headaches, dizziness, anorexia. Treatment is praziquantel, which is the drug of choice. So please take note of the different drug of choice. You can alternatively use niclosamide or nitazoxanide as alternatives. Okay, commonly, probably more common in children than among adults. Okay, the next is Hymenoleucus diminuta, almost similar. Definitive host is rats and humans. Intermediate host, you have arthropods or insects, usually flower moths or beetles. Again, infective stage is the cysticercoid larvae, no longer the eggs. The adults will also have spore suckers. It has a small rostellum, but without hooks. Okay, the eggs, we mentioned, they are characteristic. So the oncosphere, it has 2 polar thickenings, but does not have any polar filaments. Clinically, generally asymptomatic. GI symptoms can be in the form of nausea, anorexia, abdominal pain, and diarrhea. So important, polar thickenings are present, but no polar filaments. Treatment, again, praziquantel, and you have your alternatives the same. So important, how to protect rodent control, protect your grains from being invaded by beetles or cereals from rodents and droppings of rodents. So again, these are uncommon ones. Well, I don't put this in the exam, but we have other tapeworms in other animals. So Berchella studeri is a parasite of monkeys. We are just an accidental host of this organism if we ingest mites from monkeys, which contain the cysticercoid larvae. Then Rhyliatina cilibensis. Again, it's an infective stage of rats. Intermediate life cycle is even unknown as to this time. Then you have tapeworms in whales, which is actually not, but they acquire this by consumption of raw sardines. So if you eat raw sardines with plerocercoid larvae, you can actually harbor this organism. But it's generally a parasite of whales. Then you have Hymenolepis microstoma, again rodents. So you can get infected if you ingest insects which contain cysticercoid larvae, the same as H. diminuta or H. nana. I think that's okay. So you have Mesocystoides, which is an infection of primates, which probably can include humans, other carnivores, and birds of prey. And this is usually acquired by eating insufficiently cooked meat with the metacestode larvae. So careful about eating improperly cooked or uncooked meats that are not sure about its safety. Okay, so that's it for cestodes. Very short lang. Any questions or clarifications?
I guess none so far, Doc.
So very simple man lang, no? Very clear ang things that you need to memorize. Too many, but focus on, for me, no, focus on the disease of dilatum, the Tinea species, Saginata, and Solium, and Cysticercus. Those to me are the more common ones. If you plan to practice in the Mediterranean area where they have sheep a lot, eat sheep, then you have to memorize the Echinococcus species. But those are the common ones. No? So prioritize those things, those diseases. Okay? So if there's none, can we call it a day?